a lit job thing from the house, and there'll be a lot of background noise and people. So.
Okay. Thanks for doing that.
And I noticed you guys are all freezing periodically, which probably means I'm freezing to you. So if I go off, just get me and I'll come back.
Okay. I'll text you or somebody will. So I'm going to start to broadcast so people can enter the meeting, but we'll wait to start in about 30 or 40 seconds, okay? Good morning and welcome to our town hall hosted by our local legislators, Representative Kathy Kipp, Representative Jenny Arndt, and Senator Joanne Janal. Today's topic is navigating the health insurance market with Larimer Health Connect. And we have two special guests today, Amanda Spratt, who is the Outreach and Education Specialist for Larimer Health Connect, and Rosie Duran, who is the team supervisor for Larimer Health Connect. My name is Beth Jager, and I'm gonna be your moderator for the next 60 minutes. As you listen to Amanda's and Rosie's remarks, please think about questions that you would want to ask them during our question and answer session, which will be later in today's program. If you wish to ask a question, we're gonna be using the Q&A function today on Zoom, and you'll see that button on the bottom of your screen. If you wish to ask a question, simply click on that, type your question in, submit it, and we will get to as many of your questions as we possibly can. And we ask that your questions pertain to today's topic about funding options for health insurance. So it's going to be the Q&A function, not the chat function. So let's begin with opening remarks from our elected officials. And Senator Janal, can you begin, please?
Yes, thank you. Thanks everyone for being here this morning. We are continuing our legislative town halls because we're going through interesting and really important times that people need the information on a variety of topics. And I think today is going to be very helpful for folks in maneuvering through health insurance and the health insurance market. It's hard for most people to understand, including myself. I learn something new every day, and I know it changes almost every day. But we have two experts here who will help us to understand the health insurance market and maybe give us some pointers on some of the issues that are going on and help us get through this. And it's a pleasure for me to have our two guests, Amanda Spratt and Rosie Duran, here today. So thank you both. And thank you, Beth, for being our facilitator today.
Thank you. Representative Arndt?
Sure. Hi. Thanks. Thanks again. Thanks for coming, guys. You guys have been doing yeoman's work during this whole thing. I mean, if everyone feels like they're under a lot of stress, I'm certain that you are too. So thank you for all you do. And thanks for the people who are attending and maybe the people who watch it if we put it up as a recording. And thanks to my colleagues who getting ready for, we're gonna, after the election, we turn our attention straight to the legislation. So as always, call us, phone us. That's the same thing. Email us, do whatever you need to do. We're very accessible. So we're right here, and thanks.
Thank you. Representative Kipp?
And thanks to everyone for being here this morning, and thanks to Amanda and Rosie and to Beth for moderating. You know, this is a really important and timely topic, especially as we go into open enrollment season. We also have, you know, the federal government who is going to the Supreme Court to try and take away the Affordable Care Act from people. We have lived in a very tumultuous time as far as healthcare. I want to tell you that as far as our budget situation at the state, one of the options on the table, and I will tell you there were a lot of tears shed last year over all the budget cuts, was the children's health insurance program, right? And we're looking at having to do additional cuts on top of the cuts we did last year, this next year. So I would just really beg.
Okay, Kathy
So-
has frozen a bit.
Oh,
There she
I
is.
apologize. So yeah, just pay close attention to the ballot issues. I know Senator Janal and Representative Arndt and I have a town hall on Thursday with Angela Myers about voting, and we're all doing our own ballot issue forums to talk about ballot issues to help you hopefully navigate what will help people and what won't help people. So anyway, thank you very much for being here, and we'll get on with the show.
Thank you. Well, I have the pleasure now to further introduce our topic and our guests. Larimer Health Connect, a program of the Health District of Northern Larimer County, is a free service that helps people find the best options for health insurance to meet their family's healthcare needs and their budget. Trained staff provide free, impartial, remote, and in-person assistance with free and lower cost health insurance plans, including plans from the Connect for Health Colorado Marketplace, Medicaid, and the Child Health Plan Plus, or CHIP Plus. Open enrollment for health insurance through the Marketplace runs from November 1st through January 15th of next year, but there is no deadline to enroll in Medicaid and CHIP Plus. So today's discussion will help us understand how to learn about the options that are available to us and what we need to know before enrolling. Our guests today are Rosie Duran, who has been working with Medicaid and CHIP Plus for over 19 years, and the Marketplace since its inception in 2014. And Amanda Spratt, who has been working with the health insurance industry since 2017. Both Rosie and Amanda are passionate about helping individuals and families find a coverage option that works for them and their budgets. So welcome to you both, and I will pass the mic over to you.
Thank you. Let me go ahead and share my screen here with you. There we go. So like Beth just so wonderfully said, Rosie and I both work at Larimer Health Connect, which is a program of the Health District of Northern Larimer County. We are primarily in Fort Collins, but we help throughout the entire county, and we do go up to Estes Park, Red Feather, all the way down to Berthoud, and everywhere in between. So we offer free, unbiased in-person assistance. We help with the whole process, whether you just have some questions about what is health insurance, how can it help me, is there financial help available, maybe you got a bill in the mail and you're not sure what that means, and then as well as enrolling in the right health plan for you and your family. We do offer bilingual assistance. We have 4 guides who are fluent in Spanish as well as English, so we try and help out with everyone. So to jump right in, what is health insurance and why have it? So at the very basic level, health insurance is a contract between you and an insurance company. That could be here in Larimer County, that's Friday, Kaiser, or Anthem Blue Cross Blue Shield. And we feel even more than normal that living through a pandemic, it's really important to have insurance. It's gonna protect you, it's gonna protect your family, it's gonna protect our community. Being able to not feel well and immediately go in and get help is just huge right now. And it's also really easy to underestimate how much medical care can cost. So fixing a broken leg without insurance can be up to $7,500. 3 nights in the hospital can be around $30,000. And if you don't have health insurance, that's gonna be all on you. So the health insurance can really help protect you from debt. It can help you stay healthy, as we'll get into a little bit later. Preventive services are generally covered at no additional cost. So those would be your flu shots this time of year, your wellness checks, all that type of stuff, as well as for kids.
Right. And as Beth had mentioned earlier, so our program helps clients apply for a variety of health insurance. First one being Health First Colorado, which is also Colorado's Medicaid program. And that program is for individuals and families with lower income. We assist with CHP Plus or Child Health Plan Plus as well. This program is specific to pregnant women, adult pregnant women and children. We also assist with Medicare, which we'll talk a little bit more about in a little bit here, but we just became SHIP counselors about a couple of years ago to help our clients who are transitioning into Medicare from Connect for Health, Medicaid as well. And then of course, we also assist with Connect for Health Colorado, which is the state's marketplace to purchase private health insurance and receive financial assistance to help offset those premiums, those copays, deductibles, which we'll get into in just a little bit here. All right, so for Health First Colorado and CHP Plus, the eligibility guidelines, basically it's based on tax households. So if you've got mom, dad in the home, you've got 2 kiddos, so you know they claim as dependents, that's your tax household there. They do have to be Colorado residents. They must be income eligible, which we'll show you what that looks like in the next slide. And they also have to be US citizens or legal permanent residents for at least 5 years to be eligible for the program. And then pregnant women and children also need to be lawfully present to be eligible as well. CHP Plus is a program where with Medicaid, for instance, individuals and families can have other health insurance that plays as their primary insurance. Medicaid comes in as their secondary at that time. With CHP Plus, kiddos and pregnant women can't have other health insurance and have that program at the same time. And again, a huge reminder, enrollment for those 2 programs are year round. So you can apply any time of year. There's not necessarily an open enrollment period for it. Some families may qualify 1 month, may not qualify the month before that, so they can try as many times as they want to apply for those programs and qualify for them. Next slide. All right, so this is what those income guidelines look like for Medicaid and CHP Plus. For a household of 1, an individual can earn about $1,400 in gross income, so that's before taxes, and qualify for the Medicaid. For a household of 4, they can earn about $2,900 a month and qualify for Medicaid as well. With CHP Plus, the income guidelines are a little bit higher. So this program is really for those families that make too much money to qualify for Medicaid, but do not earn enough still to afford health insurance. So for CHP Plus, for instance, for a household of 4, a family can make about $5,600 a month, and for those kiddos to still qualify for that program. CHP Plus does have copays, which are between $0 and $10, and may have an annual enrollment fee based on income, which could be $25 for 1 child, $35 for 2 or more kids total, $75 for a child, or $105 for 2 or more kids total, just depending on their income. For Medicaid, copays are usually between $0 and $5, and that includes their doctor visits, their vision prescriptions. Next slide. All right, and then we also have the Medicaid buy-in programs. So these programs have become very popular. We assist a lot of families applying for these. These Medicaid buy-in programs are basically programs for individuals and kiddos who may not be eligible under the regular Medicaid CHP Plus guidelines. So based on income and whether they have disabilities, chronic health issues, they can buy into the Medicaid programs. And so basically, once you apply for these and once you're approved, you get the exact same benefits that you would get if you were just on regular Medicaid. Those copays would still be between $0 and $5. The only thing is that you may be paying a monthly premium to have that program. So for the kiddos, it could be from $0 to $120 a month. For the adults, it's from $0 to $200 per month. The nice thing about these programs too, or this program for the adults in specific, is that even if there's a household of people in there, it will only count the income of the person who is applying for that specific program. And then also that income is pretty much cut in half. So it's kind of nice. It's a very helpful program. There's no deductibles, no max out of pockets to meet. It's just regular Medicaid coverage if you're eligible for it, and you just pay a premium monthly depending on where your income level lands. Next slide. All right, and the covered benefits in these programs, so it includes their checkups, their shots, dental, vision, prescriptions, mental health care is also covered, emergency room visits, and much more. All right, and then Connect for Health Colorado, as we had mentioned, is the marketplace where people can purchase private health insurance and qualify for financial assistance. So the type of financial help that's available is to decrease the advanced premium tax credits. And basically what that is, based on your income, let's say for instance, we're browsing through plans and we find a plan that's $1,000 a month. Based on your income, if you're eligible for tax credits, let's say those tax credits may be $600 that you receive, for that $1,000 a month plan, you actually only end up paying $400 a month, and that financial assistance covers the other portion of that payment. So that usually helps families quite a bit. And then cost sharing reductions also is for individuals who have a little bit lower income, and what that assists with is the out-of-pocket costs. So your co-pays, it assists with your deductibles, with your max out-of-pockets. So at some levels, depending on income, I mean, usually those deductibles could be $6,000, for instance, and maybe your max out-of-pocket is $8,000. With the cost sharing reductions, what that helps with is it can reduce that deductible from $6,000 to $1,000 only. And then your max out-of-pocket could be $2,700 as opposed to the $8,000. So those advanced premium tax credits help with that monthly premium that you may be paying, and those cost sharing reductions assist with those costs, the deductibles, the co-pays, and the co-insurance. The other thing too that I wanted to remind everyone of, there are sites out there that kind of imitate Connect for Health Colorado, and some people tend to kind of go into the wrong website and give their information, and you get all these phone calls from numerous insurance brokers and all that. So just a reminder that the official website is connectforhealthco.com, to make sure they're typing in that correct website so that they can won't have to worry about getting all those phone calls from a bunch of insurance brokers or anyone else by entering the wrong website for this. Next. All right, and for Connect for Health Colorado, to qualify for the advanced premium tax credits, those income guidelines are pretty high. For an individual, you could make about $51,000 and still qualify for them. For a household of four, it could be just under $104,000 or $104,000 to qualify. And then cost sharing reductions, a little bit less there. For an individual, they can make about $32,000 per month, or for the year, sorry about that. And then for a family of four, about $65,000 per year.
And real quick, just important to note, those are for 2021 plans. You can still get 2020 health insurance, and those numbers are going to be just a little bit different.
Thanks, Amanda. All right, and then there are 10 essential health benefits that must be covered under any plan that's purchased through the marketplace. Qualified health plans is what they're called. So that does include emergency care, outpatient care, inpatient care, prescription drugs, your mental health services, maternity care, preventive services, as Amanda had mentioned before, are free of cost, which is really nice for families and individuals. Laboratories, so it's basically, it covers exactly the same thing as your CHP plus Medicaid programs cover, with the exception of some dental. All right, next slide.
So when can you enroll in a plan? Like Rosie had mentioned, with Medicaid and CHP plus, you can enroll anytime throughout the year, any day. It doesn't matter if you weren't eligible the month before, it's based on that current income, so you can go ahead and keep applying. And you might have it 1 month, not the month before, but you can just keep applying throughout the year. For Connect for Health Colorado plans, typically you enroll during open enrollment or a special enrollment period. So open enrollment begins November 1st, so it's coming up here in just a few weeks. and it goes through January 15th, and that would be for 2021 health plans. And then a special enrollment period, we'll touch on a little bit more, but that's if you have a qualified life event. You have 60 days to enroll from the date of that happening, and those can be throughout the year. So like I just said, open enrollment starts the 1st of November. It goes through the 15th of January. Important deadline in there is December 15th. If you enroll in a plan November 1st through December 15th, your coverage will start January 1st of 2021. And if you enroll December 16th through January 15th, your coverage will begin February 1st. And we do have extended hours throughout open enrollment just to help, especially this year with crazy school schedules and work schedules, and people are home and kids are home, and it's all just kind of a little abnormal. We have extended hours on Tuesdays and Thursdays, and then also weekends to hopefully help everyone out. So like I mentioned, a special enrollment period would be the other option to apply in a Connect for Health Colorado plan. And that would be if you got married, divorced, had a child, adopted a child, if you lost your current coverage. So maybe if you had employer sponsored coverage and you lost your job, and because of that job loss, you also lost your health insurance, that would be a qualifying event. So you have 60 days from whenever that happens to go ahead and enroll in a new plan. There is still time if you did lose your insurance or you need insurance to enroll in a 2020 plan. Otherwise, we're going to start looking forward to 2021 here in just a little bit.
All right, and as we had mentioned earlier, so we do help our customers with Medicare as well. So we provide assistance for Medicare benefits, the supplemental insurance. We'll help you look through those Medicare Advantage plans, prescription drug plans, and the Medicare Savings Program. That is actually a category of Medicaid actually for those who are on Medicare. And what that program does specifically is based on income, it will help those individuals pay their monthly Medicare premium, which is about $144 per month, and may also help pay for those copays and deductibles and that co-insurance. And we do assist with applying for the low income subsidy or extra help application, which what that does is, again, based on income, can help with those prescription drug costs. It can help bring those down significantly. And as we mentioned below, so we are fairly new at this. We've become SHIP counselors in the last couple of years. So we work under the umbrella of the Aspen Club at UC Health. And currently we are only seeing our existing clients who are transitioning into Medicare once they turn to 65. Just because we're fairly new at this, we're still kind of getting our feet wet and all that good stuff. So we will open that up at some point to everyone, but at this time, only seeing our existing clients who are transitioning into Medicare.
And then another important piece, know where to go when you do need healthcare. Using your insurance in network versus out of network is going to help save you money if you stay in network. And then knowing if this is a moment for primary care, urgent care, or emergency care. So for primary care, that would be your doctor's office. It's usually more for preventative care, annual screenings, disease management like high blood pressure, diabetes, things like that. Typically you'd call to schedule ahead and get in. For urgent care, they do offer walk-ins, but this is going to be a little bit more expensive than your primary care. If your primary care doctor is unavailable or it's not quite a life or limb situation like an emergency care situation would be, this would be a good place to go. Or maybe if it's after hours and your primary care is closed, urgent care would be another good option. And then there's also emergency care. That's going to be the most expensive out of the three. That's going to be your, well, what you think of the emergency room, ambulance, things like that. It's going to generally be open 24 hours a day, 7 days a week. You're going to pay a little bit more. You might have to wait a little bit longer depending on what your situation is and who else is there who needs medical care at the time. So just knowing your network and kind of knowing where you fall in this spectrum can help save you money while using your health insurance. So if there are any questions from anyone.
Great. Thank you so much, Amanda and Rosie. This is a very informative discussion. I want to invite our attendees to begin asking their questions. Again, you can submit those through using the question and answer button at the bottom of your screen. But I believe we do have some questions to begin. One was, what do I need to know about the pandemic and shopping for health insurance? How will this year's open enrollment period be different than last year's?
Yeah, so this year's open enrollment period, the dates of it will stay the same, so it'll remain November 1st through January 15th. Important thing to note right now is anyone who's on Medicaid or CHP Plus currently, who's been on it since, I believe, March, is locked into coverage. So that means that until the pandemic is over and the public health emergency is over, your coverage will be in place, so you don't have to worry about losing that. So that's really important to know. And then kind of what we said earlier, just with the pandemic going on, while the testing is covered, a lot of follow-up services, since we don't really know what all COVID can bring and what can happen with it. Now more than ever, it's just really important to have health insurance to give you that peace of mind and that financial help, knowing that you are covered, that you do have options, and that you're not stuck with this huge bill in the end. But yeah, so Medicaid and CHP Plus, you still have coverage, you're locked in, and then open enrollment dates will stay November 1st through January 15th.
Great, thank you so much. Here's another question. I've recently been diagnosed with diabetes. Can I still enroll if I have a pre-existing condition?
So absolutely, yes. Whether that's enrolling through Medicaid, Medicaid buy-in programs, or Connect for Health, those pre-existing conditions are not taken into consideration like they used to be. I think it was with the Cover Colorado program several years ago for those who had pre-existing conditions that couldn't really access insurance otherwise. So these programs, no, those pre-existing conditions are not looked at all.
Great, thank you. Can you further describe the difference between a Medicare plan and a Medicare Advantage plan?
So there is, with the Medicare, there's original Medicare, which you have original Medicare, you can purchase a Medigap plan to kind of offset the cost. I think Medicare usually pays about 20% and the Medigap would pay 20% or 80%, and then the Medigap plan would pay 20%. And the Medicare Advantage program plans, those are like health insurance plans, but just Medicare based. So depending on your needs, what, out-of-pocket costs, if you're someone who uses medical much more often than others, sometimes those Medicare Advantage plans may be more helpful just because they have co-pays, there's deductibles and stuff like that. But yeah, there's two parts to the Medicare, and that's either having original Medicare or purchasing a Medicare Advantage plan.
Okay, thank you. How many people have Connect for Health that would not normally have coverage?
Ooh, that, yeah, I was gonna say, I see your lips moving too, but that I would assume be in the thousands. Because there is that financial help, and the marketplace is the only place that you can receive financial help. So you have to apply through there to be able to access those financial assistance or that of financial assistance. So definitely in the thousands are on Connect for Health currently, and of course receiving financial assistance to help offset those monthly premiums and those cost sharing reductions as well.
Great, thank you.
I have a question in regards to that, a follow-up on that. It seems like since it came about, the Connect for Health, the exchange, that there's been almost 500,000 people that didn't have insurance that have insurance now, and that's quite a lot of people covered that wouldn't have been covered had we not done this back in what, 2013? Yeah. So I mean, I think it's helped tremendously to get people covered in some way, shape, or form. So
Especially too, Senator Janal, as you guys had mentioned, for those individuals that have had pre-existing conditions that were maybe not able to afford coverage before because it was so expensive, they are able to do that without having to worry about, you know, services being removed just because they have those pre-existing conditions. So it has been super helpful, super helpful.
Great. Here's another question. If I retire, can I come talk to you to figure out my options? And what would that look like?
Absolutely. So definitely, and we do have a lot of people that call us, probably that are sometimes retiring in a year and want to kind of know what those options are. So that basically, it's an appointment for us. We're doing those virtually at this point, with some exceptions for in-person appointments. But yeah, we would look at those options. We would, if you're leaving an employer or whatnot who may be offering COBRA coverage, we'll help you compare that COBRA coverage to other private health insurance coverage and see what might work best for you. So we would look at those health insurance options moving forward, whether, you know, if you're under 65, whether it's the marketplace, maybe my Medicaid buy-in programs, or over, you know, 65 and older, we can help you look at that Medicare as well.
Great, thank you. Another one is Connect for Health only online. What about those without broadband? Do you meet with them in person?
We do, yeah. So we do in-person appointments for those who don't have access to a computer or internet, or have a friend who may have access to that. So we do accommodate those individuals, and we do follow social distancing guidelines as well when they come in for the appointment. Also, people can call by phone and do an application over the phone as well, directly through Connect for Health, directly through Medicaid or CHP Plus customer service as well.
Great, thank you. Someone is asking, there was a lot of data and information that you presented in your PowerPoint deck this morning, but where can I go again to see the specific financial guidelines for Medicaid, CHP Plus, or the marketplace?
Absolutely.
Sorry, go ahead. For Connect for Health Colorado, you can go to connectforhealthco.com and click on the financial help tab. They have some tabs at the top. I believe it's like the second one. And you can see those numbers for the tax credits and then the cost sharing reductions, what the family income guidelines are, individual income guidelines. And then for Medicaid and CHP Plus, you can go to colorado.gov/HCPF and see the guidelines there as well. And then you can kind of learn more about the buy-in, how they calculate your income on that as well.
Yeah, and I want to make mention too, following up on that question, I just realized we hadn't mentioned PEAK. So individuals and families can apply for Medicaid and CHP Plus online at colorado.gov/PEAK, PEAK. That is the online system where they can just go in and apply for both of those programs, along with other programs such as food assistance, other cash assistance as well.
Okay, thank you. Here's an interesting question for you. How are your services paid for? Who funds your operations?
Yeah, so we are a grant funded program. So we do receive dollars from Connect for Health to help the individuals apply for coverage. And then we also receive dollars from our place of work, which is the health district.
Interesting. I just moved here. Does the special open enrollment period apply to me?
Yes, so it would apply. The only stipulation to that is that they had to have coverage where they moved from in order to apply for coverage here. I mean, granted, if you're just moving out here looking for a job still, looking for work, you can absolutely apply for Medicaid and CHP Plus if there's kiddos involved too. But yes, also the marketplace is available, but for the marketplace and to receive that special enrollment period, you would have to have had coverage where you just moved from as well.
Okay. What if I totally just miss the open enrollment period? Is there any other option for me to enroll?
So basically at that point, what we'll look at is we'll look at the Medicaid program. If there's children involved, we'll look at CHIP as well. And then we'll also take a look at the Medicaid buy-in programs and see if they might be eligible for that. If there is not a special enrollment period, aside from those other programs, then usually we'll refer individuals. They'll have to wait till open enrollment, but then we'll also refer them to, and I know these are other programs, but there is a discount program that may help them if they have medical costs and stuff like that. That's called CICP. So it's not a health insurance per se, it's more of a discount program, and they have to go to specific providers to receive that discount. So that may be an option as well. And then of course, we also have our safety net clinics that we refer families to as well, you know, such as Salud Family Health Centers and the Family Medicine Clinic here in Fort Collins.
Thank you. How does state and federal funding affect what the offerings are? And is there a possibility that some of those options might go away?
And that, I think, is always a question in all of our minds, because it seems like anything can potentially happen at any time. So that is a possibility that may occur. I know we were talking earlier about Child Health Plan Plus and how maybe it was going to be funded or, you know, refunded or whatnot, or not funded at all again. And of course we passed that, which is great. And the program is there and alive. But I think it's one of those things where it just, especially these days, it just seems like, you know, we just don't know. And then anything can happen at any time as well. What I think, and correct me if I'm wrong too, is that if something like that does happen, that there is some transition time to kind of look at what other options there might be, or what other help might be provided too.
Thank you. Has the CARES Act money or funding helped you during this time of COVID?
So I think it absolutely has helped. You know, as Amanda had mentioned earlier, right now, anyone who is on Medicaid, anyone who's on CHP Plus, with the exception of just a small few, are all locked into coverage. So basically, if someone's on Medicaid and they report an income change and they're not eligible any longer, they're still covered under that. They're still locked into coverage until that pandemic period is over. So that is super helpful to families. And then of course, once that gets done, then we kind of review and look at other options after that.
Okay, great. Are there any other questions at this time? I have one. How many clients do you serve? Do you actually keep a number?
We have about, I think it's about 6,000, a little over 6,000.
Wow.
Yeah.
So that's a lot. It's a lot of people.
It's really great because we do have individuals and families that come to us year after year. So you really get to know these individuals. And it's always a pleasure to see them each year. You know, you talk to each other, how are things going with each other's families? And so it's, yeah, we're very lucky. We're a very tight-knit group in our program, and we are all very passionate about what we do. We all care about what we're doing, and we care about all our families, individuals that we're serving as well.
Great. Could you remind us again what area you do cover? Is it all of Larimer County? How far out do your services go?
So we do all of Larimer County. We have office locations two in Fort Collins, one in Old Town, one up north off of Bristlecone and College. And then we have an office location down in Loveland as well. That being said, we try and get out as much as we can. Right now it's a little weird with COVID, but we try and get up to Estes Park, down to Berthoud, up north into the Red Feather area. Which I guess with the fire now too, probably won't be headed that way anytime soon. But yeah, so right now we're doing a lot of virtual, but it is all of Larimer County.
And also in addition to that too, we do have individuals and families that contact us actually from Boulder, from Denver, Aurora. and Longmont. So we actually do help those individuals as well, as long as they can get to our offices, or now that we're doing it virtually. So if they call in, we will absolutely see them as well.
I'm sure during this time, people who really do not have a lot of available finances but want healthcare, how do you balance that when people say, I really don't want to pay much every month because I simply can't afford it, but I want enough coverage for my family?
Yeah, so we do help them look through all those options, what those costs look like. You know, if there's, you know, as I was talking about the Medicaid buy-in program, for instance, we have individuals that come in for the marketplace coverage. And as we talk to them a little more, as we find out a little bit more about health issues that may be going on or whatnot, we suggest to them other options that may be available that may fit their budget a little bit better. And oftentimes that works out. And unfortunately, every, you know, once in a blue moon, you get that, you know, the person that says, I just can't afford this, or I don't want to pay this much, you know, and goes without, which is okay to do, you know, but it's also like, if something happens to you, then you're responsible for that full cost. So you got to kind of balance. We sort of give them the whole scenario of everything and what may happen if they go without, or how much those costs might look like, you know, as opposed to having health insurance and just having that security just in case.
Mm-hmm. Have you seen your client base increase or decrease during the pandemic?
It has been interesting because we were, when everything first happened back in March, right, where they were sending us all home, nobody can get out and whatnot, we were expecting to see a surge, especially in Medicaid, just because of the job loss that was happening. But for us, it kind of settled down a little bit, actually, and we were really surprised. But then we were also thinking, you know, it's a really difficult time for families. I mean, you have parents who are having to stay home to homeschool their kids at that time because school was just up in the air, individuals losing jobs that were, I think, more focused on survival, you know, meeting their basic needs first, putting food on the table, taking care of those kiddos, you know, making sure that they can pay that rent or mortgage as well. So yeah.
So with that increase in stress that we're all feeling, have you seen more people interested in making sure they have behavioral health coverage?
Yes, that is the one thing. So the health district also has a mental health team specific to adults and children as well. So we honestly have made quite a few referrals to those programs during this time, and even also before COVID hit. And yeah, so I mean, we talk to people, and just like every one of us, I think too, you know, yes, we all do feel isolated, you know, here and there, because we're stuck in our homes, we're working, not seeing very many faces around. So we do, we're lucky that we do offer those services within the health district. And we are always, that is something that's always in our forefront as well, is if we're talking to the clients or they answer some questions in our intake form that, you know, suggest maybe they do need some help, that we give them that resource information to reach out to.
That's wonderful. Dental health is very important to overall health. How much do you cover with dental for adults and seniors?
So for the adults, through the Medicaid program right now, it's a $1,500 per calendar year that they have limit. I know that's going to be, because of budget cuts, going to be cut to $1,000 starting in January. But right now for the adults, it's $1,500. For the children on Medicaid, it is just based on medical needs. So there's no limit to that coverage.
Okay, that's good to know. What about vision? Is there coverage for vision?
There is, yes. There's coverage for vision. So kiddos can get a free eye exam per year and $150 towards eyeglasses or contacts. And then for adults, they only cover one free eye exam per year, and they will cover glasses if there's been some eye surgery happened in the past or whatnot. But for the adults, they will only cover that one free eye exam per year, no additional benefits for contacts or glasses unless they've had eye surgery.
Here's a great question. If you were to give advice to our legislators on this call, what would it be, especially in light of potential additional state budget cuts?
Yeah, I would say, I mean, health insurance is super important. You know, as you had mentioned before, I mean, the amount of people that have increased having health insurance coverage since this whole ACA came into place has been amazing. And I'm sure it has saved many families lots of money and probably saved many families from bankruptcy as well due to all those medical bills. So I would just say, I mean, health insurance is super important, should remain at the forefront, should remain one of our priorities. Because really in the end, I mean, if you're taking health insurance away, that's just going to cost a whole lot more money for all of us, I think, as opposed to having that service and, you know, not having to worry about that you're going to go into medical debt, that you're going to have to file bankruptcy because you can't pay anything anymore because of your medical bills.
Mm-hmm. Mm-hmm. Here's a follow-up from our previous questions about dental and vision. Are those benefits included in coverage, or are they at an extra cost through a different plan?
Yeah, so with Medicaid and CHP Plus, they are included in coverage. For the marketplace, for instance, dental coverage is separate, so you do have to purchase a separate plan for that. And I think those usually range from about $19 to about $50 per month. But those plans purchased on the marketplace, if there's children that are on the marketplace, pediatric dental is actually embedded in all of those plans as well. So yeah, there's an extra cost if you're, you know, if you've got a private health insurance plan, you've purchased dental separately within Medicaid and CHP Plus, it's provided, it's included.
Okay, that's very good to know. Here's a timely question. Do you have any thoughts about the public health option that's being discussed?
So we are waiting to see. I know that's been, it's been coming and going, and I know that hopefully we'll be back on the bill starting in January. And that I think just provides another option for individuals. So we're kind of just waiting to hear if that actually, if it comes back and what happens after that.
Okay, thank you. Have you seen an impact from the state reinsurance program?
We do know when that actually came into place, it was, I think it was so it affected more so, or kind of, yeah, affected more so those individuals that were over that 400% of federal poverty level, which was about, I think it was like 50-something thousand for a household of one. It did not, I don't recall that it really helped those who were like under 250% or whatnot. Although with the financial assistance, that was fine, but I think it was something that more so was a benefit to those with the higher income.
Great, thank you. Okay, one more here. Do you have any idea how many insurers serve people in Larimer County in total?
How many are insured in Larimer?
No, how many insurers, how many health insurance companies, plans?
Oh, there is a lot. Within the marketplace, we have 3 health insurance carriers, which are Kaiser, Friday Health Plans, and Anthem. So those are the ones that are available through Connect for Health, but of course there's quite a bit more outside of the marketplace, such as Aetna, Humana, United Healthcare, so quite a longer list. But in the marketplace, we have Anthem, Kaiser, and Friday Health Plans currently.
Great. Well, Rosie and Amanda, you have answered a ton of questions for us this morning. Thank you for sharing your knowledge with us. I'm wondering if the two of you have final thoughts that you'd like to share with our participants and those who will be reviewing this recording going forward.
Do you want to start, Amanda? Do you want me to?
Sure. Yeah, I would just say that having health insurance is a great benefit. You never know what can happen, so having that peace of mind is just priceless, basically. And also, remind people that there are a lot of different options out there. You never know what you might qualify for or what kind of financial help you might have unless you shop around, talk to people, look at your different options. So I definitely recommend taking the time to sit down and look at everything before you make a choice, just to make sure that you are finding something that works best.
Yeah, and I agree with Amanda. Always good to look at your options. There's, individuals who, are like, no, we don't want to even look at it. We definitely can't afford it. But it's like you don't know. Like, we encourage you to visit us and look at what those options are. Because as Amanda said, I mean, some people may not apply thinking that they don't qualify for it. And in fact, that's not the case, or that may not be the case. So I would definitely say, contact us, let us talk to you about the options that are available, and then you can make an informed choice of what, might best fit your needs. And of course, just a reminder again that open enrollment is November 1st through January 15th. They must enroll in a plan by December 15th in order for it to start January 1st. If they enroll by January 15th, the plan will start February 1st. And again, that there is no deadlines for Medicaid and CHP Plus. So if they've applied for it in the past and haven't qualified, try again, because you may not qualify one month, but the following month you might qualify. So I would absolutely encourage that.
Thank you both very, very much. I'm also going to ask our legislators for closing remarks today. Senator Janal, do you want to begin?
Yes, thank you. Amanda and Rosie, thank you so much. This was extremely informative. I'm amazed at the amount of questions that have come through, and they really were significant questions to folks. I think helped answer a lot of concerns, and I think that hopefully 2021 will be a much better year, and we'll be able to continue to enroll people in the health exchange and get more help for those on Medicaid and on Medicare. And I think you'll see the Medicare population will be growing. I know that we're going to start the Medicaid buy-in program that was passed just this past session, to expand that eligibility to folks that are 65 and over. So that's going to keep you busy in the future. But thank you for helping people navigate through this, hard for most people area, but essential area for their health care. Really appreciate you two taking the time out of your Saturday to join us, and everyone else that's on this call, because this is a very important topic. If you don't have your health, you don't have anything, in my opinion. So thank you.
Thank you.
Thank you, Senator Janal. Representative Arndt?
I'm right here. Hi. Sorry, my volume is like, can you hear me now?
Yeah, we hear you great.
Sorry. Okay, everybody got off on their canvassing, so it's a little hectic around here. But yeah, thanks so much for coming, and I'm glad that we're recording this so we can put it up on our Facebooks and our websites and stuff like that. And thanks for all that you do. I really appreciate it. So,
Thank you.
Saturday morning to come and do this is very, very kind of you.
Absolutely.
Thank you, Jenny.
Sure.
Representative Kip?
Yeah, and thank you again, Beth, for moderating, and Vicki, who's back there helping out. I know you guys are awesome at doing this for us all the time, and we really, really appreciate it. And Amanda and Rosie, thank you so much for sharing your wealth of knowledge. I think, what I want people to come away from this session with is that you guys are there to help people, and it's like a free service that people should take advantage of if they're confused about their health insurance options. Because, I mean, I don't know about you, but health insurance to me is just an incredibly complicated area, and you never do know what all of your options are unless you have somebody to help guide you through the process. And so I really, really appreciate that. I want to remind people to, take a look at that blue book. There are things in our that are on the ballot this year that are going to hurt and help our state funding, which will affect the types of things that we can to cut your income taxes. And while you might say, well, okay, is it good for me as an individual to save $37 a year, or would I rather that we are able to offer health insurance options to more people, right? There are a lot of, trade-offs like that in there. I'm just put in a plug. I have on my website my own personal recommendations if you go to kathykip.com. And I tell you why, and I'll give you resources. And as I've told you, Representative Arndt has a ballot issues forum coming up, and Senator Janal and I have a ballot issues forum coming up. So I hope you'll take the time to just, think about these things before you vote. And the ballots do get mailed Friday, so this is coming up really fast in Colorado. But thank you, thank you, thank you. I don't want to get too sidetracked. We just really appreciate all you do to help out everybody here in Larimer County.
Thank you.
Thank you all. And I just want to add my appreciation to Rosie and Amanda this morning for sharing their expertise, and to thank Representative Kipp, Representative Arndt, and Senator Janal for putting together these town halls. It's a great service to the community. So thank you all for participating today, and enjoy your Saturday.
Hey, everybody, stay healthy.
Thanks so much.